hopefully once it launches and gets really big, it's going to expand and, we'll have more clients and hopefully move to a building, like my own building.
Hi guys. Hello. Happy Monday. Welcome to eShadowing, everyone. Today we have Kandace, my good friend Kandace Tulk, in today. She's going to be presenting for eShadowing. She's our guest. Welcome everybody. Kandace, thank you so much for coming on. Glad to have you.
Yes, I'm excited.
Great, you guys. I don't know if you guys all know, I worked in New York last year. I did a COVID surge, and that's how I met Kandace. We worked together. We were both like locums PAs, one of the only locums PAs in New York at the time, at least in our hospital in the department. And we just really had our bonded, and we're buddies in the ER. And so I'm glad to see her after so many months. Thank you so much, Kandace. And we stayed connected, so it's great. So Kandace, we're going to start off by, of course, getting to know you a little better and your why, as far as why did you choose PA, how you went about, or how you found out about PA and why you decided to do PA, how that process was.
All right. Hi, guys. I'm Kandace. So as far as PA goes, I actually thought about this when I was a young kid. In my pediatrician's office, there was a PA there, and I would see her every single time. My mom followed her to different clinics because she was just so great. And so I always thought I wanted to be a doctor, but given my experience with her as the PA, I just thought it would be, that was my alley that I should go through. And so I've been wanting to do that since I was 7.
Wow.
So I was pretty dedicated. You have to be very dedicated with it.
Yeah, and that's very different from other people. Most people found out in college or late in high school or late in college. So it's great that you knew at such a young age that you wanted to do PA.
Yes.
So I'm sure, being that you knew so young, that you got kind of a head start as far as patient care hours and getting everything done in college and getting your prerequisites in order.
Mm-hmm. Yeah. So I did a little bit differently with my my undergrad degree. I did general studies, and I focused it in development and family studies, biology, and psychology because it gave me more of a broad range to study. It was really good because all of the other non-biology, non-science classes were a lot easier. So it kind of boosted my GPA a little bit to kind of have a multitude of different fields. When you have a biology upper field, you're going to have to do all the prereqs to get there as well. So you end up taking almost every single class you would with biology, but it kind of helped having those other classes to boost the GPA.
Right, definitely. And you do not need to be a science major to get into PA school. You can major in just about anything. And it also shows that you're well-rounded.
Yeah, they love when you're well-rounded.
Alrighty, so let's so you did your how did you do your patient care hours? How did you get them again?
So I was actually a pharmacy technician when I was in college. So I got the experience of the pharmacy and working with patients coming from their doctor's office and stuff, but I didn't have I wasn't like a scribe or an MA or anything. I just kind of had that background as pharmacy technician, and I worked there for 4 years while I was in school.
So I'm guessing you had a lot of hours.
Yes.
And then your school, it's great that they accepted pharmacy tech, because some schools don't. Some schools say it's not hands-on or it's not like patient care, but it's a gray area. Some schools don't, some schools do, but I'm glad your school did. And where did you go to PA?
I went to Texas Tech in Lubbock, West Texas. And it wasn't my first choice of where I wanted to go. There's 5 PA schools in Texas. And so I pretty much applied to all of them. My hopes was to go to the UNT PA school, but I got my CASPA submitted right at the deadline, and it delayed everything because there's wait lists and everything like that. So it's basically first come, first serve. So if you have everything all together at once, when that CASPA opens up, that's the best thing you can do, because you don't want to wait until the deadline to submit your applications. I got really lucky making it in by doing that.
Right. Okay. And I was going to ask also, you said something that was interesting. Oh my gosh, I forgot. Okay. All right. So we can move along. As far as PA school, can you tell us how that experience was like, didactic versus clinical? Well, I was going to say that you've been a PA for a while. You've been a PA for, what is it, 8 years now?
Yeah.
PA for a while. So, and she got 8 years under her belt, guys. And so, how was PA school like about 8 years ago? How was didactic and then clinical? What was your favorite class, your least favorite? What did you struggle with?
So didactic was very, very hard. It's not easy. It's probably the worst year of my life as far as how stressed you are and everything. However, um, it's it's you're in the class 8 to 5 Monday through Friday. You're taking tons of notes, PowerPoints that are 400 plus slides a piece, having to take a test over that the next couple days after learning it. It's very accelerated where they jam pack everything into 1 year. And we basically learn everything that the docs learn in med school, but it's just more of an accelerated jam-packed class situation. The clinicals was my favorite year ever. I really enjoyed doing psychology. Even though I'm not even in psychology at all, it was just some interesting things I saw working in the inpatient psych hospital. That was just always amazing to me how things can be so different in different fields, you know?
Right.
So,
yeah. So I know you've done various specialties in the past 8 years. I know you said, some family medicine, of course, emergency medicine. So can you tell us a little bit about that? And then we're going to move forward to talk about your transition to aesthetics, which is super exciting.
yay. What was the question? I totally went blank.
about your work experience.
Oh, yes, yes. So I started off doing urgent care. I didn't get paid very well, to be honest. It was a very low paying position. But in urgent care, it's like the Care Now stuff. You kind of learn a lot of different things in one, like illnesses, injuries, procedures. You get a real hands-on experience with the procedure aspect of incision and drainage, doing lacerations, splinting for broken bones, interpreting x-rays, looking at, just seeing a patient come in. You see them and it's just like a quick visit and then they go home and hopefully they don't come back. But if they do, we always have good follow-up care with them as well. But then I decided to move to the ER. And I got in through a friend. It's kind of hard to get into a specialty like that if you don't really know someone. But knowing someone can help you get into a specific field of medicine if you have references and everything like that. But it was a lot of learning there. As a PA in an ER, you're going to be seeing every patient that walks in the door, depending on what kind of ER it is. For mine, I would have the patients come in. I would do all the workup, start everything. Let's say you have a geriatric patient who has chest pain and falls and has a trauma. So you're going to have to work up the chest pain. You're going to have to work up the injury. You're going to have to stitch them up. You're going to have to do basically a CAT scan, make sure they don't have any fractures. So it's really interesting to see what you can see there. You literally see everything in the ER. Just your mind will be blown if you go. It's definitely a good experience to start off with, just so you get an exposure to literally everything known to man.
Right. So why did you decide to switch specialties and go into aesthetics? How did that?
So I've always had an eye for, beauty and aesthetics and, all that stuff. And I really got into it because at first I thought I wanted to do dermatology. And that was really hard to get into. If you really want to do dermatology, I would recommend getting a elective in that so that you can actually get some experience. But I decided, I was like, okay, well, maybe I should go to the National Laser Institute. It's in Dallas. It's a really solid training on how to do Botox, fillers. There's also something called microneedling with plasma. So basically you draw your patient's blood, you spin it down in a centrifuge, and then you extract the plasma, and you can microneedle the face with little it makes tiny abrasions onto the face, and you just massage that plasma in. It's kind of like a vampire facial is what you might have heard it as. But yeah, it's a lot of procedures. I've always loved having procedures, and I love to see like the transformation there.
Yeah, I think I first saw the micro needling, the plasma thing. I think I first saw Kim Kardashian do it. I'm not even gonna lie. I saw it on Instagram one time years ago though, and
Yeah.
I more, you know, it's more popular now. I guess more affordable, but yeah, that's awesome. So
Yes. Oh, I was just gonna say, also, I just wanted to work for myself. I'm so tired of, sometimes the corporate world can be a little hectic when it comes to your jobs and everything. And so when you have your own business, you kind of get to make your own rules and see your own clients, and then they get to love you as much as, everyone else loves you in this field. PAs are just always pretty well loved by their patients.
yes, and that was actually going to be my next question. So how did you go about like this? It's not only a specialty change, but you're kind of getting into a new like kind of career as far as being an entrepreneur and owning your own business. How was that?
So I never would have thought in a million years I would open my own business. I've not ever been someone who is entrepreneurial, but once I took the course, I met a lot of nurse injectors, like RNs. They're the only other people besides NPs and PAs and doctors that can do injections of Botox and fillers and stuff. And so they were opening their own clinics. And so I was like, how is this possible? So I talked to them a lot about it, and there's a lot of steps that go into it. You got to form a limited liability company. So for that's just your basic get started. It's a professional entity to protect you in case something happens. And so as a PA, you have to have a PLLC, which is a professional limited liability corporation. And that's because we're medically licensed in the state of Texas. So it's like for lawyers and doctors and PAs and stuff. So after that, you kind of have to think about all your product that you're going to want to do. You need to open bank account in your business name, your PLLC. You got to open a bank account to do your transactions and keep, everything separate. It's a lot of steps. So, but
yeah, I'm listening. Sorry.
No, you can go.
No, I was going to ask about your supervising physician. How did you have, because you'll need one since you're a PA, you'll need like a medical director, somebody, what are you going to need somebody, are you going to have to chart? Are you going to need somebody to sign off on your charts? Is that what the supervising physician is for? Or will you need a supervising and a medical director? But so how did you go about all of that, getting a doctor on?
So there's this amazing doctor. He's an anesthesiologist. His name is Dr. Amir Balouch. He's in Dallas. And he is medical director for 50 plus med spas in the DFW. So he's very inclined. Wow. He knows exactly what needs to be done, and he helps you all throughout the way. I would find someone who is very knowledgeable about aesthetics in general, like someone that's experienced it, because it is a long process to really get everything. But I do use an EMR. It's called Calista Pro, and it's like an aesthetics type of EMR. And basically, he is going to be my supervising physician as well as the medical director. So I just put him on the medical board as my supervising physician. And in the state of Texas, PAs can only own 49% of a business max. And the doctors have to partially own it with you, 51%. Wow. So that was kind of a struggle, because this doctor that who's so awesome, he's like, well, I don't really want to be like in your business. I want to help you grow. So basically he just kind of helps, he signs off 10% of the charts, and then he gets paid a monthly fee on, just a baseline fee every month for him to just sign on, do the review of your 10% of your charts. And he just kind of makes sure everything is rolling, functioning properly. And you have you need like a standard operating procedures book. He kind of can give you some helpful, insights with that. But you've got to have a procedure for everything. You have to have it all documented in a book. And so he's kind of helpful with that. But other than that, he doesn't really want to be owner of my business. He wants to just help me in any way he can, you know, and it's really awesome. I would say get a good lawyer who can do a agreement between you and your medical director so that there is no question on what is his role or her role, and what strictly lay it out, because I went back and forth with my lawyers and his lawyers to get this perfect agreement made. And so it just kind of protects you in case something were to happen. You know, you're partially owning this business with someone. So, you know, you got to make sure the contract will say, hey, if you want to abort this or like not be the supervising anymore, you got to give a 60-day notice. And, you know, just so you can find someone else to take over that position. But you'll always have to have someone a doctor with you on that if you're in the state of Texas. I don't know about other states.
Right. Wow. That's a lot. That's a lot. And two, you know, it just sounds very, you know, intimidating to take on. So I salute you for doing all of that. It's been less than a year. Guys, we finished in New York in July? So she's done this. It's been like 8 months or so. So I salute you, Kandace. And so how did you learn all this? Was so a lot of the teaching from the medical director, since you had so much experience? Did you go on YouTube? Did you go on? I'm sure you went through various websites, but was he great as far as a mentor and helping you, kind of guiding you through the process?
So basically, I kind of just did this all on my own. It takes a long time to really get everything established. You have to have a bookkeeper, an accountant. You have to have your taxes, you know, your bank accounts. You have to have everything lined up. And so I just did a big to-do list, and I kind of wrote it all down, and took it step by step. So I learned, I got my training. So when I wanted to do dermatology, I was like, maybe I can get my training with Botox and fillers, and then I can get a job easier. Well, while I was there, we got to work for 2 weeks or maybe a week or so, doing people that it was like a school. So people would come in and get cheaper services for us to practice on them. So we got to practice on actual patients. And a lot of those training programs out there are just like a educational video, but this was hands-on. So that was really good. And just the networking of people you can meet just by going to one of those classes. I've already made, you know, business partners and friends, and you know, people that are going to always want to support you, especially those other injectors. They post videos on Instagram. There's a Facebook group for aesthetics wellness, where you can learn, you can ask questions and see what the latest trends are in aesthetics and stuff. So it's a lot of different things you can do.
That's amazing. That's amazing. And when are you guys opening? Because I know you have a spot, you have a studio, right?
Mm-hmm.
So
yes.
Yet or?
So I'm actually going to launch probably within this week or so. I haven't really gotten started yet because you have to get your malpractice insurance coverage. You have to have your Square payment so they can pay you, and you have to have all your products and everything. So that's kind of why it's taken me, you know, several months to really get through all of it. It's a lot, but so worth it. Once you have everything squared away, you just get started. And luckily for me, I got a little salon in a building full of hairstylist salons, and kind of just introduced myself to the hairstylist, said, hey, refer 10 clients to get, you know, hair restoration, and I'll give you a free service. So that's kind of how I'm building my, my marketing. But you can also pay for marketing on Facebook and Instagram as well, which I will be doing later. But for now, I'm just kind of doing a word of mouth, giving my business cards to friends and family, who then give it out to friends and family, you know. And so that it's just, you kind of got to build your way up, basically.
Right. And did you have to hire a practice manager or someone else to kind of come along with you besides the medical director?
No, I have a lot of different people on my side. So I have my accountant and my bookkeeper. The bookkeeper's probably will be more of a management thing there. So she just kind of makes sure all the income and profit is all lining up. And make sure the inventory is there with product. And there's a ton of different products you can use. There's Allergan and Galderma, different. You got to open up accounts for each one to order medications like the Botox and the fillers and stuff.
And the bookkeeper will also keep track of that. So like when you're running low, they'll automatically order for you, or
yeah, you can pay them to do that, but for me, I'm just starting off. It's just me, and I don't have a whole lot of clientele at this point. So I'm doing everything myself, really. Just I don't have a whole lot of product. I have enough to get started, but hopefully once it launches and gets really big, it's going to expand, and we'll have more clients and hopefully move to a building, like my own building at some point. That's my goal.
Yeah, I was gonna say, I'm sure like the Texas or Dallas market, is a large market as far as, aesthetics and, of the female population or younger, older women that want to, of course, stay beautiful for life, right?
Yeah. And you can even do cool things like Botox parties where you have, 10 women or men or whoever you want to come. And it's super simple. It takes about 10, 15 minutes to do someone's Botox. And then they kind of to have a little fun with their friends and everything while you're there. And it's a good way to make that initial money to kind of get your stuff. And then those 10 people will be like, oh, I got this done with her. So it is a big word of mouth things as well. So I'm just going to hopefully get people to do Google reviews and just get my name out there.
That's awesome. Look at you being a hustler. Yes. Okay. So we're going to move to answering some questions, guys. So can you explain someone asked, can you explain why it is difficult to get into specialties? Is entry into specialties dependent on your skills, people who get you in, or is it the situation of students trying to enter them?
The market in DFW is pretty saturated with a lot of APPs, advanced practice providers, with nurse practitioners and PAs and all the good stuff. I will say, like, it's hard to get into anything, honestly. When you first started, you have to have at least 1 year of experience before you want to switch to any other job. But like I said, I started low and I got my experience, and then I was able to move up and had a lot more knowledge than I did the first year. Because the first year coming out, you're not going to feel like you know how to do anything. You're just like, how did I pass school? Like, what am I doing? So it's a learning process. And as long as you have a really good supervising physician you can go to ask questions and train you and everything, it's amazing.
Yeah.
But it's hard to get in because there's a lot of people in with doing this, the doctors have to spend time training you on how to do certain procedures. And in dermatology, it takes anywhere from like 6 months to a year to really learn everything. Yeah. And so what was happening was some people would get that training and then move to another location. So a lot of times it's really like they just want someone with experience in the field so that they don't have to train them. Does that make sense?
Yeah. Dermatology is, highly coveted, but it's difficult, just because of that demand and interest. It's hard to get in.
Yeah, I would say it's good to get a broad range of like when you first come out to not specialize, but at the same time, if you really know exactly what you want to do, which I thought I wanted to do pediatrics, and oh goodness, no, I do not want to do pediatrics. But that's what I always thought. I was going to be a pediatric PA. And I kind of just learned that I can see pediatrics in the ER, in the urgent care, so I didn't want to just kind of specialize because I kind of learned you learn more. And when you're fresh out of school, it's easier to retain everything if you go into that. But if you want to specialize, I would do so at the very beginning if you know exactly what you want.
Right. Like I thought I wanted to do a BGYN before PA school. And then I saw it and I'm like, no, I'd rather do ER. So he said, let's see. Would you recommend a new PA to get into aesthetics?
Would I recommend?
Yeah.
Yes. Oh, yes, definitely. Aesthetics is a very fun thing to do. I know I did my first client on my own. It was actually a friend of mine, and she, whenever you're doing lip injections, it gets really swollen, a little bit bruised, and you can feel like kind of some lumps in your lips over the a week or so. And so she said, Kandace, I hate my lips. They're too big. They're swollen. And I was like, give it time, give it time. It will go down. And now she absolutely loves her lips. And it's rewarding because you're like, oh my gosh, they are showing your product. They're showing your skills.
Yeah.
You know, they're walking around being an advertisement for you. And so just getting to make a difference just in the little ways, like it's very subtle. It's nothing too big, and you can always gradually increase. But yeah, I really like the field more than I've liked anything else so far. So, I mean, I just really, I just love procedures. If you're not a procedure person, then you probably shouldn't get into it, but I would recommend it. Yeah.
And somebody wanted to know, what was the course that you took in Dallas? The
What'd
class,
you say?
the name of the class or the course, the company that you went to take the certification.
It's called the National Laser Institute, and it can be a little pricey, but I think it's kind of worth it because you market and meet so many people and learn so many things from it, and you just get that hands-on experience instead of just like taking a little course and just watching videos. So they're really nice there. They're amazing. I loved it there.
And
They also do.
I said it's an investment.
Yes, it is. It's definitely a good investment. And they do, there's so many things you can do. Instead of just doing Botox and fillers, you can do PDO threads, that kind of like an all natural facelift. You can do chin, nose. You can do the lips, obviously, get some cheekbones here. If you put some filler like right in here, it kind of pulls up and decreases wrinkles up in here too. So it's pretty interesting.
Nice. This is really interesting, especially seeing, how your transition from when we talked about it to you making it happen.
Yeah. I'm glad it's happening.
Yes. That's what you call going after what you want, guys.
Yes. You can do anything your mind you set your mind to. Just think about it that way. It's a process, but you have to keep going. And if you need to take a break and say, I can't think about this right now, I took like a month where I didn't do anything. And I just was like, I'm just going to relax for a minute because it can be overwhelming. Just take it slow, do it in your time. And as long as you really know like what you're doing, it shouldn't be too difficult.
Somebody had a good question. So would the doctor still take most of the money from your business since they own more of it?
No. So in the contract that my lawyer and his lawyers, they kind of drew up was basically he will receive the monthly fee and his name has to be on the bank account too, which is unfortunate, but you have to really trust your medical director and know that like they have your best interest in mind, which most people do, but you just got to be very careful sometimes too. But so we do have a shared bank account, but when the client pays for the product, it'll go through that bank account. And then I actually have another LLC as a management services organization. It can get very confusing, but basically I pay from the med spa, the PLLC, I pay the LLC a management fee. So you kind of can take money in and out like of that account.
I bet you watch a lot of YouTube. It's like, it all sounds like, oh my gosh.
Yeah, it's so much. It took a while for me to grasp, like, how is this possible for a PA to really get their own thing going? Yeah. And it's really, I feel like the only field you could really do that in, because you could probably do physical exams and stuff for people, but being able to just kind of go out on your own, they're there to help if you need them and everything. But like, yeah, we've did the contract where it's like he will get the monthly fee and then he's not going to try to like come out and get anything else because he's got all those other med spas and everything. So
you make so much money from all those med spas being the medical director there.
Yeah, imagine.
Okay, somebody asked, how do you see the PA career evolving? NPs now have DNP. Will PA require more education? Or on the management side of healthcare, I used to work on a unit. It was pretty clear nurses had a hierarchy in management, but PAs really didn't. I just to kind of answer that, I think because nurses, there's so many subfields of nursing. There's like, nurse practitioner, registered nurse, licensed practical nurse, certified nursing assistant. I think that's kind of why there is a hierarchy. And then because nursing is such a large field and so many, there's so many nurses and so many nursing departments. I think that's why it seems like there's a hierarchy. That, there's the charge nurse, and that's kind of the same with, but it's also because PAs are under the medical board. There's not a PA board. We're licensed by the medical board, so we're trained with physicians or like physicians. So we're also more under the hierarchy of the medical directors, the medical director of the whole ER. So I think that's why, if I'm answering the question, you can also add on to that as well, Kandace.
Well, yeah, PAs actually do have more limiting factors to them. I mean, as a PA, you really can't, it's not easy to own your own business because of that shared, the laws and everything. I think they're going to let up on those laws soon, but don't quote me on that. But I think they're going to kind of make it a little bit easier. But yeah, as a nurse practitioner, you can actually own your own business without having them be part owner. You still have to have a supervising physician, but yeah, it's unfortunate because we really dig deep into our training, and we have so much training that we do, and it is unfortunate that we don't have as many, autonomous rights, basically.
Right. And we do a lot of the same things. I mean, clinically, there's not a difference really at all as far as the clinical practice, especially at least in the ER, as far as our roles. And also, the nursing field has been around for ages and ages, years and centuries. So I guess they have that, to back them up. But PAs are coming up as well. So yeah. Somebody said, would the doctor still oh no, we answered that already, I'm sorry. So somebody asked about RVUs. Not every ER has or offers RVUs. I never worked in an ER that offered RVUs. RVUs are like an incentive based on how many patients you see or the work you do. But did you ever work in an ER or urgent care with RVUs?
No, I haven't, but I know in dermatology you can get that stuff.
Okay. Yeah, we didn't either, but not every practice has that. And let's see. So somebody wanted to know, what's the ballpark average of malpractice insurance as a PA with their own business?
So I can actually quote you. I just got a quote on how much it's going to cost, and it's $3,000 a year.
Oh, that's actually not bad.
3,700, I think. Yeah, for the year.
To own your own practice?
To insure your entities. So I insured my PLLC and my LLC I named it on the malpractice insurance, and then you put your medical director on there as an admin only, and then you get coverage. Basically, this is a cool thing to know. There's an aggregate limit and another type of limit on malpractice insurance. If you do the 200-600 route instead of the 1 million 3 million, that's really all you need for aesthetics, because if someone comes after you, it's not going to be more than that. And so I was told that if you do get the higher aggregate limits, people may want to go after you more, which is crazy.
How would they even know you have that? Huh? How would they even know you have that? That's your aggregate limit.
Their lawyers can get access to all that information. Yeah.
Dude, they'll find out. Wow. Okay.
You have to worry about getting sued at all times in the medical field. And they say, if you haven't been sued, then you just haven't really been practicing long enough. It's something that happens almost to everybody. And you just want to make sure you have your insurance to take care of you, because it's got to include those lawyers as well. So you got to make sure it covers all that stuff, so you don't end up having a big out-of-pocket expense for a lawyer or whatnot.
So is $3,000 for both entities or each?
What?
Is it $3,000 for both entities, your LLCs, or?
Yeah, just for the whole year to have all that included on there, it was $3,000 a year. Yeah, $3,700.
Good.
Yeah, I was kind of shocked at that. I thought it would be way more, but that's not that.
Wow, no wonder so many recruitment firms can afford it.
Yeah.
Okay, let's see. Just reading some more questions, guys. So, what kind of treatments? We're gonna get into that a little bit. She's gonna go over a quick case study or a typical patient that she would see as far as discussing treatments and what she would do for a patient. So we'll get into that in just a bit, and we'll just answer some more other questions. We're gonna answer that. What are some ways that Botox and or fillers can be used for medical benefits?
Botox can be used for hyperhidrosis of the axilla and sometimes even the sole of the foot. A lot of people don't want to use Botox for their feet because it really hurts to get. You have to have a lot of injections. It's a lot more Botox than what you would put in your face, but it helps with increased sweating. They've also done Botox to help with migraines, treatment of migraines. But yeah, it's so what we say is like, if you want to start doing Botox, you should sooner before you get these deep setted wrinkles in, because what it'll do is it paralyzes these muscles so that when you're raising your eyebrows or like squeezing your eyes really tight, you don't have those wrinkles, and it just kind of paralyzes the muscle, and it wears off in about 3 months. So you kind of just go back and back. So if I were to do a vampire facial on someone, it's an all natural Botox. And so it would be 3 sessions, spaced out between 4 weeks. And then you would do once a year after that. And it really gets rid of like the wrinkles. So you wouldn't have to keep going back for the Botox, but it's a little more pricey. So people want that instant result. This one takes a lot more time, but it's really an all natural, great way. And when you you can inject the plasma or you can microneedle it in. So if you have someone with bags under their eyes, you can inject their tear troughs with the plasma, and it tightens and strengthens the skin and stimulates the color to help brighten it and everything. So it can help with like bags and stuff. But you can also do, like, let's say you want to get rid of these lines here, you could do the cheek fillers, and it kind of pulls your skin back a little bit. But I'm going to include a whole lot more later on down the road. But right now I'm just getting started. So I'm just doing the Botox and the fillers and just kind of the basics. I'm also going to try to do hormone replacement therapy. There's these BioT pellets that you can start putting in your practice, and you kind of just check their blood. It's all cash pay, so there's no insurance that's involved. So if they want to do it, they would have to get the labs paid for on their own, which they're not too expensive or anything. And then they get, I think it's like every 6 months they get a new pellet. It dissolves into the skin, so it lasts longer than going and getting a hormone shot every month, which is what most people do. So that's cool. And then there's just a bunch of different things you can do. You can do wellness and diet and everything. It's just whatever you want to incorporate in your business.
Right. I can't wait to see how yours expands. Amazing.
Yeah.
Somebody was just asked, how does insurance / billing work with aesthetics, as a lot of procedures are cosmetic. So yeah, you don't charge insurance. It's a cosmetic procedure.
Yeah, the insurance would not cover you to get a Botox treatment, like for anything other than, you can probably get it covered for hyperhidrosis, but not for cosmetic. No cosmetic procedure is going to be covered by insurance.
Right. But so if a patient were to come in and I guess want to or try to go through their insurance, or would you ever accept insurance, or would you? Okay.
No, because you have to have a whole underwriting team, and that's just way too much. Like if they really worry about and want to use their insurance, they can go to a dermatologist or something to do it. Right. But the cool thing is, as a PA, you can order the labs, you can order prescriptions. Let's say you have a patient that they say don't do lip fillers on someone who has like a history of herpes simplex type 1, because it can flare that up. So sometimes if they do have a significant history of that, you can actually prescribe them some Valtrex to take a couple days before they get the treatment to prevent it from happening. And that's the cool thing, is that a lot of other LLCs that were formed by nurses, they have to get their medical director to call in any medications that they may need. So you kind of get to do everything on your own, which is cool. And ordering labs and everything, you're a provider. So you can order anything you want, basically.
Right. Okay, we're going to answer a few more questions before we have Kandace kind of does a run through of her day and details more about working in aesthetics. Is microneedling safe for skin of color, so people of color?
What did you say?
Is microneedling safe for people of color?
It is, but there's something, I forgot what it was called. I'll have to research it and get back to you on it. But sometimes with darker skin tones, you have to do like a scale of the skin tones, and it's called I think a K Flesher skin tone, something like that. But basically, you have to do it a little bit differently because sometimes they can break out and have like big splotches on their face. I've seen it happen, and it's like overproduction of the melanin or something like that.
Okay.
So, but it's good for most people. I just have to really like dig into that and figure out what that condition is that can happen with darker skin tones. So I'll look into that and get back with you on that.
And someone wanted to know, I'm sure probably not at the moment, about in-person shadowing for pre-PA students in Dallas. Do you offer that for in-person shadowing?
I might, yeah. When I get started, yeah, I love to teach. I love being a mentor. I used to train nurse practitioner students. When I was in the urgent care clinic, they would kind of get their hours with me. So yeah, because I have my own business and I don't have to worry about the whole corporate side, I can, make that decision if I want to have a shadow, and so I would love to have some of you, just to kind of show you what it's like. I love teaching.
Great. So guys, is it okay if I share we kind of already did in the post, but your Instagram and social media? I know it's like Kandace Olivia.
Well, my Instagram for my business is called Kissed by Kandace, KYSSED, because there's a kiss filler, lip filler. It's spelled KYSSE, I think. And so I did Kissed by Kandace because it starts with a K.
Okay, I put her IG there, guys, and here I'll put mine as well. Okay, and we'll answer one more question, and then we'll have Kandace quickly go over a little case study or day in the life of an aesthetics PA, and the types of patients she'll see and how she would go about as far as the case. Let's see. What about being a PAC would you change, and what are some problems that PAs face in school and after graduation?
I guess the autonomy aspect, like, in comparison to a nurse practitioner, they get to, they're able to own their own clinics. And it's honestly good that you have a supervising physician that you can lean on, but sometimes you want to be doing your own thing completely. PAs have not very many limits. Like, we can do any field of medicine because we get trained in all different fields. So a nurse practitioner, the difference is they can only specialize in one section. So let's say you want to do family medicine, you can't go from family medicine to psychology like a PA can do. Right. And so if you want to change up your field completely, let's say you want to do plastic surgery or you want to go from there to OB-GYN or something like that, you have that ability. So that's awesome. And yeah, I think I'm trying to think of any other limitations. What do you think?
I think we touched everything. I think I definitely agree with you.
Most of the doctors really trust their PAs. Like, they really trust you and they let you do, as long as you're comfortable, do what you need to do at most places. So if you're comfortable doing something, then they pretty much get to do whatever you want.
Right, and everything will fall more into place as you get more experience. Transitioning from pre-PA or PA school actually to new grad can be rough. There's always that learning curve. But as you get that experience in your first job, especially have good support, then it gets a lot easier. And then even going to the next job or the next specialty, it really helps. You'll know what to do. Yeah. Alrighty, Kandace, we're gonna talk more about your role in aesthetics. Can you tell us? I don't know if you figured out yet. Oh, well, you should. I guess know by now. Like, how are your hours? And like, what's the patient population like? What are typical cases that you expect? And I know you're like building your clientele. So can you tell us a day in the life of an aesthetics PA?
So you're going to get clients of all shapes, sizes, colors, and everything like that. And, whether it's a young woman who wants their lips done or an older woman who wants, her wrinkles eliminated. So the first thing you got to do is have a consultation with the patient. And that's basically, you do a good faith exam, and a good faith exam can only be done by a doctor, NP, or PA. You can't do it as an RN, but you see the patient. You can do a consultation and a treatment in the same as long as there's just a good faith exam where you go through their entire medical history, you say, hey, do you have any autoimmune diseases? Do you have a history of HSV? Do you have, because like there are contraindications to this stuff. So if you're pregnant, it's not advised to get anything done. And so you kind of just go through like you would a regular patient. You kind of just get their whole history and interview them and kind of say, give them a mirror and let them look and say, what are you looking here? What do you want to improve, or what do you want to change? And, you know, they'll say, oh, well, I don't like having bags under my eyes, so I think I want to do like a Botox under there. So I'll be like, okay, well, I don't think the Botox is going to be as beneficial as like the plasma, because the plasma can help tighten and strengthen, but you can also do fillers in this area as well. So you kind of go by what they're wanting, and then you kind of pick out what would be the best option for them to fix whatever they're worried about. And so you can also offer, you know, packages where you can say, okay, if you get this amount of lip syringe, then you get another one free or something like that to kind of, you know, get more people in the door. But yeah, you just kind of go in, you look at them, you do, you clean their face. It's just like any other procedure. Do the injections. There's a lot of different techniques for everything. You can do micro cannulas where you do a introductory point here, and you put the cannula in underneath the eyes and kind of pull it in that way, so you don't have to stick them so many times, because when you stick them, they bruise, and no one wants to go having a bruise on their face for however long that takes. But then you kind of discuss your skincare. Do you wear sunscreen? Do you wash your face? You know, try to get them into some kind of good skincare routine. I'm going to be using Zio, which is a really good company for facial cleansers and exfoliants and sunscreen and everything like that, because everyone needs to be using sunscreen.
Yeah, I definitely agree with that. So no matter what your skin color, skin complexion, sunscreen is so important.
Yeah.
Okay. So, oh yeah, I was asking about, you know, being that you are, you know, now you own your own business, you're not working for anybody, you don't need to, you can clock in, clock out when you want. How are you going to structure your hours and days of work?
So I haven't really decided that yet. For now, I have it like Monday through Thursday, yeah, doing like 9 to 9. Once I get really like busy and have like a steady patient population, then I'll probably do maybe a 9 to 5, or in some weekends, like every other Saturday or something like that, so that people that work throughout the day can still get their Botox done. So it's pretty good hours. It's whatever you really want to do. If you want to work longer, you can. If you don't want to work as much, you get to do whatever you want to do. So I have it open from 9 a.m. to 9 p.m. and they'll call in, make an appointment between that time. And I will usually, since I don't have a whole lot of clients yet, I'll just go up to the studio, do their service, and then maybe leave. But once this has a bunch of people coming in, then you kind of book it back to back like you would a regular doctor's office.
Right. Awesome. It's the luxury of just doing your own thing, working for yourself, being your own boss. So being that you know, made this, that was actually also a question, being that you've made this big investment and you're in the field or specialty that you love, can you really see yourself doing anything else at this point? Or is the future, I mean, you never know what the future holds, but as far as where you are now?
Yeah, I think this is my final step because I have so much growth I can get from this. My goals are to hopefully own like a couple of med spas here in DFW, or, you know, branch out a little bit, being able to hire RN injectors or PAs and Ps, being able to let them train them on how to do everything. And, you know, I eventually want to have my own building. Right now I'm just in a salon studio. So it's a very small studio. It has the injection chair. And it really doesn't have, it has just all the products and stuff, but I want to have a building with like doors and, you know, to patient rooms and everything, and have it full, and, you know, have people working for me as well.
Yes. And right now it's just you. You haven't really hired anyone outside of the administrative, outside of like the bookkeeper and the attorneys.
Yeah.
You haven't hired anybody on staff.
Yeah. Yeah.
Okay.
For now, there's a telephone number. It's an app called Spruce. And so you can actually get a phone number for your business through this app. And then they can call that business phone and you can send text messages through it too. So they can book online or they can book using that.
And your company is called Evoke Aesthetics. Evoke. I helped come up with the name, guys.
Yes.
That was the name I decided on, but they all were cute. All her ideas were cute.
Yeah, I thought that Evoke was like, okay, we're gonna like brighten you. We're gonna make you feel good. We're gonna make you feel confident in your little procedures that you want to do or whatnot. And so I feel like I liked the spelling of it with the QUE.
Yes.
So someone was like, does that say Evoke? I was like, no. but I do like it.
Awesome. And another interesting question was somebody asked, you don't right now, but I've seen commercials for like non-invasive, non-surgical, like rhinoplasties or minimally invasive, but they're not like it's not an actual surgery. But
It's a filler.
Oh, it's a filler because I saw it on Instagram. Like, how did they do that?
So basically, if you see like the ridge right here, there's like a divot right here. And so you can actually inject right here at the bridge to kind of make it straighter. And because you're adding out some here, you have to add it to the tip of the nose. So you put it right here so it kind of points it up like this. So you kind of put some filler in this tip of your nose and on the bridge. It makes it look like you've had a nose job. It's amazing.
Yeah, because I saw some ads for it on Instagram, and I'm just like, what? Like, this is crazy. I think it was a nurse that was doing it. I'm like, okay, so this is not something surgical at all. So, wow, do you plan on ever implementing that in your practice?
Yeah, I'll do that. You just have to get specific training because in the nose is very vascular, and the problem with fillers is that you can actually put a filler into an artery and cause a vascular occlusion.
Yeah.
And you'll really be able to notice if it happens. It's very painful. It turns the skin a discolored, like a light color, pale, dusky, and the patient will complain a lot of pain. It's normal to have like soreness after you get injections, but not pain. And so we have this remedy called Hylenex. And we just inject it into the area where we feel there might be an occlusion. You just infiltrate this Hylenex and it just dissolves the filler completely and it goes back to normal. All's good.
Wow. Oh my God.
So you always have to aspirate when you're doing injections. You want to aspirate to make sure you're not in a vessel. And so you don't want to occlude that vessel by putting filler in it.
Wow. Yes. Yeah. We had an aesthetics PA before and she explained that, and that's so interesting. But of course, thank you so much for this entire session. And so, especially being a business owner now, what advice can you give to students that because you're on the two sides of things, you're on the medicine, being a PA, and then now being a small business owner, entrepreneur. What advice can you give students that are now interested in this? Because a lot of times, they thought, we're going to go to PA school, be a PA, kind of work for somebody, work under somebody, or take orders from people. And now you're taking your own orders. Now you're your own boss. So what advice do you have for the students?
I would say definitely make a list. To-do lists are like literally your saving grace because there's so much you have to do and everything comes step by step by step. So making lists is good. Also just, if you have a dream, just follow it. Like, do it. You can do it. You can do anything you set your mind to. And, when I was in your guys' shoes and I wanted to be a PA before I got accepted and everything, I didn't have any backup option. I said, I'm going to be a PA and I'm going to do it. There's no other option because that's what I want to do. And so that's kind of how it is. You kind of just got to stay strong. It gets tough, but then you just got to power through and continue to go with your dreams, and it works. It really does. You just have to have those like compelled, just I don't know. So
yes, it's possible, definitely possible, especially in less than a year. Kandace has had so much growth. Of course, she's a phenomenal PA, but just seeing her evolve into a business owner and an entrepreneur and learning as much as she has, like, girl, you are the bomb. You are a boss. It's
yes, and you with your app and everything, you're doing your business too. It's awesome.
yeah, well, thank you so much. So, guys, just to see, the living legend that it's possible to be an entrepreneur, to do a business as a PA. You can do anything you want in this profession. So, just a little motivation for you guys. So, thank you so much. Sorry that we couldn't answer all your questions, but we are running out of time. I'll once again put her IG. It's at KYSS by Kandace with a K, both with
Mhm. Yes, yes. I don't have much content on there yet, but it's coming soon. It's coming soon.
yes, he's launching soon, guys. So even if you want some Botox in the Dallas area, go to
Yeah, definitely direct message me if you want any services. I would love to treat you guys.
yes. Thank you so much, guys. So this has been a great session. Thank you again, Kandace, for coming on.
No problem.
Girl, thank you. It was so nice having you. Thank you for answering all our questions and being so helpful.
All right. Well, thank you guys for listening, and I hope you have a good night
Someone
and
asked
follow your dreams.
Someone wanted to know, are you going to have a grand opening?
Oh, I actually am. I'm going to do it on March 15th, I think.
Yes, you guys, you hear that? And of course, follow her so you can stay updated on that. I'm sure she'll post it on her page.
Yes, I will. All right. Thank you.
Bye. Good night.
Bye.
Bye.